That burning in your feet at night that makes sleep feel impossible. That tingling in your toes that comes and goes without warning. That strange numb feeling like your feet belong to someone else. If any of that sounds familiar, I want you to pay close attention to what I am about to share because most people dealing with neuropathy symptoms are doing the exact wrong thing in response to them. They are waiting. They are managing the pain. They are looking for the right pill or supplement to make it stop. And while they are waiting, the nerve damage continues progressing quietly in the background. What researchers have now demonstrated is something that genuinely changes the conversation around neuropathy. Specific exercises, done consistently at home with nothing more than a chair, have been shown in clinical studies to actually stimulate the regrowth of nerve fibers, not just reduce symptoms, not just slow the progression. Actual new nerve fiber growth visible under a microscope in skin biopsies taken from neuropathy patients before and after an exercise program. I am Wesley Harper, and today we are going through 6 exercises designed specifically for older adults dealing with neuropathy in the feet and legs. I am going to explain exactly why each one works, how to do it correctly, and how to build them into a simple 15-minute daily routine that you can do at home without any equipment. And I want to ask you something before we go any further. Drop a comment right now and tell me where your symptoms are worst: feet, toes, lower legs, and how long have you been dealing with this? I read every comment in this community, and your answer helps me understand what people here need most. Now, before we get to the exercises, I want to make sure you understand what is actually happening in a neuropathic nerve, because once you understand that the exercises make complete sense, rather than just feeling like generic movement advice, your peripheral nerves are essentially long cables running from your spinal cord all the way down to your feet and toes. These cables carry multiple types of signals in both directions. Signals from the brain telling your muscles to move. Signals from the feet telling the brain about temperature, pressure, pain, and position. When these cables are healthy, the communication is clear, fast, and precise. Your brain knows exactly where your feet are at all times. You can feel the difference between a soft surface and a hard one. You can sense your balance shifting before you lose it. When neuropathy damages these cables, the signals get scrambled. Your brain receives noise instead of clear information. That noise is what you experience as burning and tingling. The complete absence of signal is what you experience as numbness. And when the position-sensing signals are disrupted, what is called proprioception, that is why your balance becomes unreliable and why falls become a serious risk. The most common cause of peripheral neuropathy is diabetes. High blood sugar damages nerve fibers through a process called glycation, where sugar molecules essentially stick to nerve proteins and damage their structure. This accounts for a large percentage of all neuropathy cases in older adults. But neuropathy also develops from vitamin B12 deficiency, which is particularly common in people taking metformin or acid reflux medications, from alcohol consumption, from certain chemotherapy drugs, from autoimmune conditions, and in a significant number of cases, the cause is never clearly identified even after thorough investigation. Here is what matters most. Regardless of the underlying cause, the pathway to improvement involves the same core principles. Consistent movement that increases blood flow to the nerve tissue, specific exercises that stimulate the nerve pathways that are damaged and force them to work, and balance training that directly targets the proprioceptive nerves that affect fall risk. The research that changes everything comes from a study where scientists took skin biopsies from neuropathy patients before and after a structured exercise program. Under the microscope, they could see new nerve fiber endings growing back in the skin after consistent exercise. This was not a subjective feeling of improvement. This was visible, measurable biological change. Exercise was the intervention. The chair was the equipment. Consistency was the key. Let us get into the 6 exercises now. Before we do, I want to mention something about supplements briefly because I know many people are using them. The supplement with the strongest clinical evidence for neuropathy is alpha-lipoic acid at 600 milligrams daily. Multiple clinical trials found it reduced pain and tingling by 30 to 50% in neuropathy patients. Vitamin B12 is also worth having checked specifically if you take metformin or acid reflux medications, because both reduce B12 absorption and B12 deficiency alone causes neuropathy. One thing most people do not know is that vitamin B6 in doses above 50 milligrams daily actually causes neuropathy rather than treating it. Check the labels on any supplements you take, but please always talk to your doctor before starting or changing any supplement. Now let us get into the exercises. The first and most foundational exercise category is cardio. And I know some people are going to hear that word and immediately think, this does not apply to me because their mobility is limited or they do not feel safe walking outside. So I want to start with a specific seated cardio option that works at home with zero fall risk. Sit in a sturdy chair with your back straight and not leaning against the backrest, your feet flat on the floor. Now begin lifting your knees one at a time as if you are marching in place. Left knee up, right knee up. Keep a steady rhythm. Add your arms so that the opposite arm swings forward as each knee comes up. Left knee, right arm forward. Right knee, left arm forward. The pace should be comfortable enough that you can still speak a sentence, but energetic enough that your breathing picks up noticeably. Start with 3 minutes and add 1 minute every few days as it becomes comfortable. The goal is 10 to 15 minutes per session, done twice a day. That gives you 20 to 30 minutes of daily cardiovascular activity without leaving your chair and with virtually no fall risk. Why does cardio matter for neuropathy specifically? The study that demonstrated nerve fiber regrowth used aerobic exercise as the primary intervention. Cardiovascular activity increases blood flow throughout the body, including to the small blood vessels that supply your peripheral nerves with oxygen and nutrients. Nerves that are being adequately supplied with oxygenated blood have the biological resources they need to repair and regrow. Nerves that are poorly perfused do not. Cardio is not optional for neuropathy recovery. It is the foundation everything else builds on. If you can walk outside comfortably, that is excellent. A stationary bike, if you have access to one, is another great option. Swimming and water walking are ideal because the water supports your weight completely while your circulation works hard. But for days when outside is not an option, or when balance is a concern, the seated march gives you all the cardiovascular benefits safely at home. Now drop a comment and let me know. Have you been doing any regular cardio since your symptoms started? I want to know because a lot of people with neuropathy stop moving thinking rest is the answer. And the research is clear that this is the opposite of what the nervous system needs. The second exercise addresses what is arguably the most dangerous practical consequence of neuropathy, and that is the elevated risk of falling. Neuropathy disrupts proprioception. That is your body's internal sense of where it is in space. Normally, without even thinking about it, your feet send constant signals to your brain, telling it exactly where your weight is, how the ground feels beneath you, and when your balance is shifting. Your brain uses this information to make the dozens of tiny automatic corrections that keep you upright with every step. When neuropathy damages these sensory nerves, the signal becomes unreliable. Your brain is making balance corrections based on incomplete and inaccurate information. And the result is that by the time your brain registers that you are off balance, you have often already fallen. The single leg stand exercise directly targets this. Stand behind a sturdy chair with both hands on the back of it. Shift your weight slowly onto your right foot. Lift your left foot just barely off the floor, not high, barely an inch, just enough that all your weight is on the right foot. Hold that position. If you can hold it for 30 seconds on each side, that is excellent. If you can only manage 5 seconds right now, start there. That is exactly where you need to begin. 3 rounds on each side. As this becomes easier over days and weeks, progress in stages. First, take one hand off the chair. Then both hands resting lightly on the chair without gripping. Then both hands completely off. And when that feels comfortable, try it with your eyes closed. The eyes closed version is where something genuinely important happens. When your eyes are open, your visual system is compensating for some of the missing proprioceptive information. Your brain uses what it sees to help maintain balance even when the nerve signals from your feet are unreliable. When you close your eyes, you remove that compensation. Your brain is now forced to rely entirely on the nerve pathways that are damaged. It demands more from them. It forces them to work harder. And like any biological system pushed to work harder, they gradually strengthen and improve. Do not rush to the eyes closed stage. Be patient with the progression. But know that each stage you reach represents real neurological improvement. Many people notice a meaningful difference in their balance within 2 weeks of daily practice. The third exercise works beautifully alongside the single leg stand, and together they take about 5 minutes to complete. Heel-to-toe weight shifts. Stand with your feet shoulder-width apart with one hand lightly on the chair. Slowly shift your weight backward onto your heels so your toes lift just slightly off the ground. Hold for a moment. Feel your weight over your heels. Then smoothly and slowly roll your weight forward from your heels through the middle of your feet and onto your toes. Your heels lift gently. Hold at the top, then slowly roll back again. 15 repetitions. 2 sets. The pace should be slow and deliberate. This is not about speed. Every millimeter of that rolling shift is a conversation between your feet and your brain. This exercise does 3 valuable things simultaneously. It trains your balance through controlled weight shifting. It strengthens the calf muscles that support your stability during walking. And it stimulates the sensory receptors in the soles of your feet, the mechanoreceptors that detect pressure and position, sending a continuous stream of signals up through your nervous system. Every repetition is essentially your feet saying to your brain, I am here. I can feel the floor. Pay attention to this information. For people who have largely lost sensation in their feet, this stimulation over time can help re-establish neural pathways that have gone quiet. The brain responds to repeated signals by reinforcing the pathways that carry them. Consistency is what makes this happen. Now let us move to the 3-foot specific exercises that target the nerves and small muscles in the feet directly. Exercise 4 is calf raises at the chair. Stand holding the back of a sturdy chair. Slowly rise up onto your toes. Count 1, 2 at the top. Then slowly lower your heels back to the floor. Count 1, 2 at the bottom. The key word is slowly. Do not bounce. Do not drop. Controlled deliberate movement in both directions. 12 repetitions. 2 sets. Rest 30 seconds between sets. For neuropathy specifically, this exercise delivers 2 distinct benefits. First, the calf muscles, when they contract, act as a biological pump, pushing venous blood from the legs back up toward the heart. When they relax, fresh oxygenated blood flows down into the feet and lower legs. This pumping action directly improves circulation to the nerve tissue in your feet. More blood flow means more oxygen. More oxygen means more capacity for nerve repair. Second, every single repetition sends proprioceptive signals from the soles of your feet through your nervous system all the way to your brain. You are training the full length of the neural pathway from the bottom of your feet to the top of your spinal cord with each controlled rise and lower. When 12 repetitions becomes comfortable progress to trying it on one leg, hold the chair for balance and do the same controlled movement on a single foot. That is a significant progression, so take your time getting there. Exercise 5 is one of my favorites because it is something most people have never tried, and the first time they attempt it, they genuinely understand what has been happening to the nerves in their feet. Towel scrunches. Sit down in a chair. Place a thin hand towel flat on the floor in front of you. Sit in bare feet and place your foot on the near edge of the towel. Now, using only your toes, try to scrunch the towel toward you. Spread your toes, grab the fabric, squeeze and pull it toward you. Release, spread, grab, squeeze and pull. 10 repetitions on each foot, 2 sets. The first time most people try this, their toes barely move. They know what they want the toes to do. They can clearly see the towel sitting there, but the message from the brain to the toe muscles travels through nerves that have been damaged, and the response is slow, weak, or almost absent. That disconnection you feel between your intention and your toes is exactly the neuropathic nerve damage at work. But here is what happens with daily repetition. The brain begins reinforcing whatever nerve pathways are still functional. The movement becomes slightly easier, then a little easier again. Within a couple of weeks, most people notice their toes responding more reliably. That improvement is not just mechanical, it is neurological. The communication pathway is being used and strengthened. When the towel becomes manageable progress to picking up small objects with your toes, marbles, pencils, rolled up socks, moving them from one spot to another, the finer and more specific the movement, the more precisely you are working the sensory and motor nerve pathways in your feet. The sixth and final exercise is one that can be done while sitting comfortably watching television or sitting at the kitchen table. Ankle circles and the alphabet. Sit comfortably with your foot lifted slightly off the floor. Slowly rotate your foot in a full circle 10 times in one direction and then 10 times in the opposite direction. Make the circles as large as comfortable. Feel the ankle joint moving through its full available range. Then using the tip of your big toe, write each letter of the alphabet in the air. Large, deliberate letters that require your foot and lower leg to move in many different directions. Take your time with each letter. This exercise does something the other exercises do not. The alphabet movement requires your lower leg muscles to contract and extend in an enormous variety of directions and combinations. Every letter is a different path. Every path works different muscle groups and nerve pathways. The variety of movement stimulates nerve endings that repetitive straight-line exercises miss entirely. It is comprehensive neurological stimulation through the simple act of writing letters with your foot. It also has zero fall risk, can be done seated during any quiet moment in the day, and most people find it genuinely engaging because they are focused on forming the letters rather than counting repetitions. Now let me bring these 6 exercises together into the simple daily routine that makes them practical and sustainable. Every day, 15 minutes divided into 3 parts. Part 1 is the cardio foundation. Seated march for 5 to 10 minutes. Get your breathing elevated to a comfortable conversational pace. Blood is moving, circulation is reaching your nerve tissue. The healing environment is established. Part 2 is balance training. Single leg stand, 3 rounds on each side at whatever level you are currently at, progressing toward eyes closed over time. Then heel-to-toe weight shifts, 15 repetitions in 2 sets. Together, these take about 4 to 5 minutes. Part 3 is foot activation. Calf raises, 12 repetitions in 2 sets. Towel scrunches, 10 reps per foot. Ankle circles and the alphabet. Together about 4 to 5 minutes. Total time, 15 minutes. Every day. 3 principles that determine whether this actually works for you. The first is to start at half of everything. If it says 12 repetitions, start with 6. If it says 30 seconds, start with 10. Nerves do not respond well to being overwhelmed immediately. They respond to gradual, consistent stimulus. Start smaller than you think you need to. Add a little more each week. The second is consistency over everything else. 15 minutes every day is dramatically more effective for nerve recovery than an hour 3 times a week. Nerve fibers grow slowly. The biological process requires repeated daily signals to keep progressing. Missing days interrupts the signal. Daily practice keeps it going continuously. The third is to check your feet after every single session without exception. Blisters, red spots, small cuts, areas of skin irritation. When sensation is reduced in your feet, damage can happen without you feeling it. 60 seconds of looking at your feet after every exercise session protects you from wound complications that could otherwise become serious problems. Let me also speak to something important for those dealing with severe symptoms or specific conditions. If you have foot ulcers or open wounds on your feet, please see your doctor before starting these exercises. If your balance is severely impaired, please do these exercises with a family member or caregiver present the first several times until you have established your safe level. These exercises are designed for older adults with neuropathy symptoms, and they are safe when done as described. But your specific medical situation matters, and your doctor should know you are beginning this program. For nutrition, the most impactful dietary changes for neuropathy are reducing sugar and refined carbohydrates to lower the glycation burden on nerve proteins, Eating foods rich in B vitamins, including eggs, small oily fish like sardines, leafy greens, and legumes, and staying adequately hydrated because even mild dehydration reduces blood flow to peripheral tissues, including nerve endings. Let me be honest with you about what to expect from this program. Neuropathy symptoms did not develop overnight, and they will not resolve overnight. What most people notice in the first 2 weeks is a modest improvement in their balance and a slightly better sense of connection between their feet and their brain. The tingling and burning often begin to reduce more gradually over 4 to 8 weeks of consistent practice. Significant and lasting improvement takes 3 to 6 months of daily commitment. But here is what I want you to hold on to. The research shows that nerve fiber regrowth is possible. The exercises that produce that regrowth in clinical studies are the same 6 exercises I have walked you through today. The result depends almost entirely on whether you do them consistently. The biology is in your favor. The only question is whether you will give it the daily 15 minutes it needs. If today's video helped you, please give it a thumbs up. It genuinely helps more seniors dealing with neuropathy find this information when they are searching for real answers. Subscribe if you are not already part of this community. Every week I bring you honest, practical health information built specifically for adults over 60, and leave a comment below. Which of these 6 exercises are you going to start with today? And tell me where your symptoms are worst so I understand what this community is dealing with. I read every single comment. Take good care of yourself. Your nervous system has more capacity to recover than most people have been told. Give it what it needs every single day. I will see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.